hello, everyone. I'm Dr. Maya Moroto from the Partnership for a Healthier America. We're so glad you could join PHA Summit for an important conversation around food equity. So, before I introduce our esteemed panel, I wanted to talk for just a few minutes about how we at PHA define food equity. So, we believe we've reached food equity when every family in every zip code in America has access to good food. And what does that mean, good food? That means food that's affordable, sustainable, nutritious, high quality, and culturally connected. And our work at PHA helps people access good food. And we know that it's not enough to just define food equity. It's important for us to understand the structural issues that contribute to a lack of equitable access and to listen to others' viewpoints on how to achieve food equity in partnership with public, private, and charitable food systems. And why does this really matter so much? It matters to us because we know there's no true equity in society without health equity. And health equity is impossible to achieve without first addressing food equity, because we all know good food is an important catalyst for good health. PHA is releasing a defining food equity paper in conjunction with this year's summit. And more importantly, we're convening this very conversation, the first of many to build on what we learned during the process of creating that paper. We hope that this paper will be a living document that's improved by many voices and perspectives over time. Our paper outlines three important pillars necessary to support food equity. First, a healthy food supply in the public, private, and charitable systems. Also, access to affordable, good food in all communities. And lastly, awareness, knowledge, and skills that empower people to select good foods and to quickly prepare them at home. So I am just so excited to introduce our panel of preeminent experts in food equity to discuss what we're working on together to achieve. Dr. Angela Odoms-Young is an associate professor and director of the food nutrition education in the communities program at Cornell University. Her research centers on understanding the social and structural determinants of dietary behaviors in low income populations, including communities that are predominantly Black, Indigenous, and people of color, and identifying culturally appropriate programs and policies that promote health equity, food justice, and community resilience. Dr. Odoms-Young has over 20 years of experience partnering with communities to improve nutrition and health, and she has served on numerous advisory committees and boards, including the Institute of Medicine Committee to revise the WIC food packages and the Council on Black Health. Dr. Odoms-Young is also currently serving as the inaugural Equity Visiting Scholar at Feeding America. Dr. Priya Fielding-Singh is a sociologist, ethnographer, and assistant professor of family and consumer studies at the University of Utah. Her research and writing examine issues of social, economic, and racial justice with a focus on food and nutrition equity alongside maternal and child health. Her first book, which I absolutely loved, devoured it in 2 days, is called How the Other Half Eats, The Untold Story of Food and Inequality in America. And this book draws on years of ethnographic field research that she conducted on families' diets in the San Francisco Bay Area to reveal new pathways through which social and environmental factors drive disparities in diet and diet-related disease. Her research has been published in top sociology, public health, and medical journals, and has been featured in outlets such as the New York Times, the Los Angeles Times, the San Francisco Chronicle, and the Harvard Business Review. Dr. Sara Bleich is the Director of Nutrition Security and Health Equity in the Food and Nutrition Service at the USDA. She is a policy expert and researcher who specializes in diet-related diseases, food insecurity, and racial inequality with more than 175 peer-reviewed publications. She is on leave from her post as a professor of public health policy at the Harvard T.H. Chan School of Public Health, the Kennedy School of Government, and the Radcliffe Institute for Advanced Study. Dr. Bleich was also a White House fellow during the Obama administration, where she worked at USDA as a senior policy advisor with First Lady Michelle Obama's Let's Move initiative. And I'll also add that Sara and I go way back. We actually went to elementary school together. So shout out to Roland Parks Public School in Baltimore, Maryland, for obviously getting us both off to a great start. So let's start our conversation with the overarching topic of food equity. So now that you've heard PHA's working definition of food equity, I'd like to hear from each of you on how your work builds on or complements this definition of food equity. So let's start with Dr. Odoms-Young for this question.
Thank you so much. And also thank you for the invitation. As you mentioned, a big focus of my work is on social, cultural, and structural factors that influence dietary behaviors and health outcomes. But I'm particularly interested in how we partner with communities to look at solutions. So that varies across the board. It can be more grassroots partners, so whether it be food pantries or community-based organizations, or other government partners like local WIC agencies or federally qualified health centers. So really, I don't focus on any one sector. I think it's important that we're all on board. And so when we talk about food equity or we talk about access, food is everywhere. But it's not only food, it's the resources that you need to get food. And so part of the idea and the resources that might compete with you getting food. If you look at the differences that we have improved some outcomes for everybody, but we really haven't closed those gaps. And that's really related to structural factors. And that becomes very important in not only building individual capacity, but building capacity of communities, particularly, and again, my focus is on BIPOC and low-income communities, to look at how they can be in the lead of solving their own issues and that they're given that capital, those resources to really come up with their own solutions. And a lot of my work is around how do you support that?
Great. Thank you so much for that. It's, really important, I think, for us to keep in mind how complex this is. It's not a sort of a simple thing. So now I'll turn it to Dr. Fielding-Singh.
Yeah, well, thank you so much, first of all, for the invitation to be here and be in conversation with all of you. The definition of food equity that you laid out and that Dr. Odoms-Young further fleshed out really resonates with me and the work that I do with families and communities. And what I particularly love about these three pillars that you've shared is this recognition that the food we eat is really intimately connected to the neighborhoods that we live in and the schools we attend and the places we work. And so rather than focusing on this individual behavior change, we need to really be shifting our attention to the key structural inequities that make it really difficult for significant swaths of our society to consume a health-promoting diet. So I'm a sociologist and an ethnographer, which means that I spend a lot of time on the ground with families and communities, particularly those that have been traditionally marginalized, trying to understand how exactly these broader systemic inequities drive disparities in our diets and diet-related disease. And through my work, one thing that's become really clear to me is that I think in our discussions of food equity, we need to be rethinking and in some ways broadening what we mean when we talk about access to healthy and health-promoting food. And what I mean by that is that in my research, I find that this access is, of course, geographic and it's financial and it's temporal. But broader structural inequalities that shape our lives also generate a really important psychological component to access. Access is in part about living a life with sufficient resources and social support and financial stability and security that make a nutritious diet practical and desirable and compatible with your life. Access is also about having the cognitive and emotional bandwidth to be able to actually prioritize healthy eating. It's, for instance, about being able to go to sleep at night every evening knowing that there will be money for you and your kids the next day so that you're actually able to prioritize their nutrition instead of their satiation. And so one thing that I show in my work is that this sheer experience of living in poverty, of not knowing whether you're going to be able to make next month's rent or keep the heat on in the winter, it doesn't just make it difficult to afford or access food, though it does those things too. Living that close to the bone can also fundamentally shape the way that a person feels about and uses food. And I find in particular that for lower income parents who are having to raise their kids in contexts of scarcity, contexts where they have to say no to their kids all the time about so many things that children are asking for, junk food is actually one of the few things that parents have the ability to say yes to. And so they can use that food to sometimes buffer their kids against scarcity, to show kids that they love and care for them, even when they also at the same time want their kids to be consuming a healthy diet. And so this is all to say that I think access, as you've laid out in this definition, is essential to food equity. And at its heart, access is structural. But the broader systemic inequities that we're talking about also drive an emotional and psychological component to access that I think that we need to be paying attention to and thinking about as we design practical and thoughtful interventions to advance food equity.
Thank you so much for that. And that was what I loved so much about the book, was that broadening of the conversation to include those psychological and emotional components that you could just see so clearly. So, Dr. Bleich, what would you like to add?
Thanks so much, Dr. Moto. It's great to be here, and do want to apologize to all of you for my voice. I did lots of screaming at my daughter's soccer matches over the weekend, so I'm paying for it now. But it's great to be a part of this conversation, to share the stage with such impressive women. So I would say that one of my key reflections is that USDA and PHA are very closely aligned when it comes to this idea of food equity, and appreciate the opportunity to reflect on your new report and our relevant work to promote and elevate nutrition security. So at USDA, we are very committed to tackling food, nutrition, and security. And when we say nutrition security, it's very similar to your concept of food equity. What we mean is having consistent access to healthy, safe, and affordable food. And our efforts to promote nutrition security, which we're really prioritizing right now, they build on and complement decades of work to address food security. But this concept of nutrition security that we're focused on is distinct in two ways. It recognizes that we're not all maintaining an active, healthy life, which the definition that PHA has put forward does as well. And it emphasizes taking an equity lens. And so at USDA, we're really prioritizing nutrition security in four ways. We're aiming to provide meaningful nutrition support from pregnancy to birth and beyond. We're trying to connect all Americans with healthy, safe, affordable food sources. We're developing, translating, and enacting nutrition science through partnership, and we are prioritizing equity at every step of the way. And to do all this work, we are leveraging four key equities. So we have our nutrition assistance programs, which reach tens of millions of Americans, including more than 30 million children each school day, nearly half of all infants in the US, and this is at about 99,000 schools and 250,000 retailers. We also have our nutrition education and promotion efforts, which total more than $1 billion per year across all of our programs. The largest is SNAP education and WIC nutrition counseling. And in addition to those, our Team Nutrition, which is part of the Child Nutrition Program, recently awarded about $5.5 million in grants to help 21 states increase local foods and school meals. Another key equity is translating the dietary guidelines for Americans through MyPlate and by broader investment in research in food systems. Many of you may have seen that we posted the scientific questions for the 2025-2030 edition of the dietary guidelines for public comment, and look forward to hearing thoughts on that. And then finally, another key equity that I want to mention is all the other things happening across USDA, which has so many ways that it touches food and nutrition, such as the Gus Schumacher Nutrition Incentive Program, which is known as GUSNIP. So I think one of the key things that I want to make sure I leave with you all today is that while USDA has significant equities in this space and is really trying to do a lot, we can't do this work alone. And so we're really excited to see PHA's commitment to advancing food equity and look forward to the future work where we can intersect and tackle food, nutrition security, and advance racial equity as we move forward.
Well, thank you for that. And I was, of course, so delighted when USDA created your position and to see the strides that USDA is making with nutrition security and health equity is really quite astounding. So thank you for that summary. So let's turn our conversation to, we kind of touched on this in the initial question, but I'd love to hear each of your thoughts on some of the barriers to food equity and how communities are overcoming those barriers. So at PHA, we're very interested in asset-based solutions. So if you can, in your comments, talk about why asset-based solutions are important, that would be great. So let's start with Dr. Fielding-Singh.
Yeah, so I think even in the responses to the first question, so many of these barriers really came up. I'd love to spend my couple minutes talking about one particular barrier to food equity that I think is being now tackled in a really thoughtful and innovative way by communities across the country, and that barrier is time. I think in our discussions of time in the public health community for a number of years, we've tended to focus really traditionally on the purely quantitative part of time, like how many minutes in a day a person can devote to cooking, for instance. But those conversations have also kind of obscured that time has a qualitative nature to it as well. And what do I mean by that? Well, what I mean is that for that parent who works 2 or 3 jobs in the service industry, who stands on their feet all day, who comes home at the end of the day with aching legs and calloused heels, even if this person had a half hour or an hour in the evening to cook, it's also completely understandable that the last thing that they might want to do is stand in the kitchen, potentially alone, and cook a healthy meal. And that's because the work of cooking and feeding healthy food is labor. It's hard work. It's not always fun. Your kids don't always like what you make them. I know from personal experience. And we need to acknowledge that when we talk as a public health community about cooking and preparing homemade meals as part of the solution to food equity. Even if people have the time, even if we can come up with meal ideas that can be made in a half hour, we can't just expect primarily women, primarily mothers and grandmothers, to silo themselves in kitchens and cook healthy meals. And I say all this because what I see happening in communities that are addressing this is actually an explicit recognition that healthy meal preparation is an act of labor and an act of love. And that for it to make sense, for it to fit into people's lives, it also has to include the things that make life worth living. Like it has to be joyful, and it has to be rich culturally, and it has to be socially connected. And I think that's a really asset-based approach to addressing things like time scarcity, because all of those things already exist within communities: cultural traditions, social networks, joy, community resilience.
Wow, I love that idea of invigorating cultural traditions and multiple generations. That is such an important facet for us all to keep in mind. Dr. Bleich, what would you like to add?
So I want to pull on threads that Angela and Priya mentioned in their initial comments, which is as we think about some of the key barriers to food equity at USDA, we think about it as nutrition security. I think we have to be very clear to call a spade and talk about structural racism. And just for folks not familiar with that term, what it refers to is the ways in which society fosters discrimination through systems that rationalize discriminatory beliefs and justify the distribution of resources based on those beliefs, which makes it difficult for communities of color to secure quality food, education, jobs, and the list goes on. And so what that means practically is that structural racism harms health, and it does it in ways that can be described and measured and dismantled. And this is where these efforts around nutrition security, food equity, where they come in and where they can actually make a difference. So at USDA, with the direction of our secretary, Tom Vilsack, there's a very strong focus on nutrition security in response to the pandemic, in response to the administration's goals around advancing racial equity, and recognizing this strong connection between diet-related chronic conditions like diabetes and COVID mortality. And so what we know is that COVID brought health disparities and this vital need for access to healthy food right up to the forefront. And so there's one study which estimated that nearly 2/3 of COVID-19 hospitalizations in the US were related to 4 diet-related conditions: obesity, diabetes, hypertension, and heart failure. And these disparities are associated with decades of structural limitations to retail food outlets that sell healthy food, and they are rooted in systemic racism. So at USDA, we're trying to do a lot to help. And we have a lot of activities underway, and we are working hard to grow new paths to promote and elevate nutrition security. So an example of something that we've already done, particularly focused, Dr. Murto, on your point about assets, is that we recently reevaluated the Thrifty Food Plan, and that is the basis for calculating SNAP benefits. So SNAP is a supplemental nutrition assistance program, which serves about 41 million people per month. So we were directed by Congress, this was included in the 2018 Farm Bill, to do this evaluation. And based on it, we increased the benefit of SNAP, the monthly benefit, by 21%. Now, this was the first permanent increase to the purchasing power of SNAP benefits since the Thrifty Food Plan was introduced 45 years ago. And so what that essentially is doing is it is putting healthy food within reach. And this is really important because prior research found that nearly 9 out of 10 SNAP participants struggled to achieve a healthy diet because the cost of healthy food was cited as the most common roadblock. And then there are a lot of other things that we have on the horizon, all in support of trying to promote nutrition security. So for example, we are updating the WIC food package with science-informed changes. We are updating school meal standards. We're also trying to support and incentivize school food operators to pursue changes even more aggressively. And we're launching the next edition of the dietary guidelines. And then the final point that I'll make is we can look to the President Biden's fiscal year 2023 budget for additional investments that arguably will be transformational. So in addition to supporting our core nutrition programs like SNAP, like WIC, the budget also continues the enhanced cash value benefits through 2023 for women and children in WIC. And I'm particularly excited that the budget has a nutrition security line item, and that's proposed to be $23 million. And that's going to hopefully further our work to promote and elevate nutrition security with a focus on building and broadening our capacity to deliver effective nutrition education and promotion.
Wow. It's amazing that you can be here. You are busy with all of these amazing initiatives that are coming out of USDA. So Dr. Odoms-Young, what would you like to add to this?
Yeah, I would actually like to pick up on both comments. I think Sarah's comments about the infrastructure that's needed. I think many times we think about families being able to overcome these limitations. I also worked for many years as an ethnographer, worked on an ethnography right after welfare reform. Over several years, 3 years after welfare reform was passed, where I was in homes, in communities, understanding what families were facing. And I think one thing that's really important is to acknowledge, as we acknowledge, as Sarah talked about, acknowledging structural racism. We have to acknowledge food as a human right. We also have to acknowledge the fact that some conditions that people are living under, they're unacceptable conditions. So part of the idea of what we do now and then what's the long-term goal, I think when we think about these solutions, we have to think about infrastructure development, and we have to put resources in the hands of communities to really come up with their own solutions. And then how can other structures, corporate structures, and others support that? But the ultimate goal is really eliminating structural racism, eliminating income equality, and supporting families. And then it's funny, I'm talking about these big pictures. I want to back up a little bit and talk about something small and immediate before I forget, and that's food marketing. So if you are already under duress and somebody is marketing happiness to you, or this is what's going to satisfy your children, that's structural. Ethnic marketing, unfair, ethnically targeted marketing, marketing towards low-income families is really an issue. And so some of these things are meantime. We need to have great trauma-informed nutrition education. We need to have equitable marketing of healthy foods in communities, but we also have to deal with those root causes and deal with the long term. And I think we can work on those things together.
No, I love that, splitting it into kind of the long view and then the immediate steps as well. And that kind of really takes us into our last discussion topic, because we know that people are tuning in and listening to this panel today because they probably want to be involved in the movement towards food equity. So, what are some steps that we can take and that people can take to make movement in this area? So, how would you recommend that people connect in with the food equity space? So let's start with Dr. Bleich.
Thank you. So a few thoughts here. First, I would say that while USDA is very committed to leveraging our available equities to promoting and elevate nutrition security, we cannot do it alone. We cannot solve the problem of diet-related conditions and disparities. I also want to point out that while we have considerable resources, they are very much dwarfed by the problems that we are trying to fix. And so that's one take home. The second is that in mid-March, Secretary Vilsack released a report which outlined USDA's actions on nutrition security, and I encourage you to read it if you haven't already. What that report tries to do is clearly define USDA's lane, and by doing so, to make it clear where others can step in and create complementary value, and where we aim to maximize new or existing partnerships. So for example, not all of those who are eligible for our programs are participating. This is true for about 1 in 2 people eligible for WIC. We need our partners to lift up the value of our programs and the benefits of participating in them. And third, we look forward to working with organizations like PHA and the various organizations that you partner with to try to cultivate new and enhanced existing partnerships to make meaningful changes that promote healthy eating across the country, particularly among historically underserved communities. And I also want to say that one of the things that I try to make a real point of doing is to underline that while I care passionately about these programs as a professional, I also care about them personally, because as a child, my family was a recipient of then food stamps, now it's SNAP. We also received WIC for a period and also had some participation in school meals. These programs matter. They are not necessarily going to fix the problem, but they are one of our most powerful tools to help families get healthy food within reach. And we really need your help in partnering with us to figure out how do we amplify these efforts and make sure Odoms-Young's point that we close the gaps that we don't want to have.
Thank you. So turning it over to Dr. Odoms-Young, what would you like to add on this topic of what people can do to move things forward?
I think one thing as a first step that's really important is to look within your organization and do an equity analysis. Figure out where can you leverage the work and the influence that you have to really have an impact when it comes to equity. Whether it be corporate or industry, or if it's, community organizations, where do you think, in looking at equity, diversity, and inclusion, that you can really have an impact? And part of that is disaggregating data to understand where are the gaps. Sometimes it's hard for us to think about how do we close something that we really need to have more knowledge about. So I think different structures as we engage, ethnic marketing is a good example. Are you is there some excess marketing of unhealthy food towards certain communities? Are you marketing your healthier products towards those same communities? You can close that gap when you understand what's being targeted, who's being targeted. And I think that's with anything. It really starts with you and your organization where you have the most influence. I think the other part of that is, as individuals, we all need to have a better understanding about how inequities impact society. We all lose. And I think many times we think about it's certain populations, it's us against them, and reframing to understand that we all lose. In some ways, people are like, well, what does this have to do with healthy food or nutrition security? But the structures that impact nutrition security also impact education. They impact the wealth gap, over policing. All of these things are not just by chance, they're all a part of the same infrastructure. So I think it's important in our scope of influence, how do we understand the inequities better? And then how do we make even small steps to address those inequities?
Thank you for that. And Dr. Fielding-Singh, will you close us out with your thoughts on this topic?
Yeah, thank you so much. There's so much on what Dr. Bleich and Dr. Odoms-Young said that I want to pick up on. I think the way that I think about solutions and movement is both changes that we need to make to the food system related to so many issues that have been brought up around targeted marketing, around expanding universal school meals, around retail access, but also remembering, as mentioned, that addressing food equities always demands addressing broader structural inequities. And so one thing that I think all of us can be doing is advocating and fighting on federal, state, and local levels for social and public policy that advances racial, socioeconomic, and gender equity. Because when we work to dismantle structural racism, when we advocate for livable wages and affordable housing, when we fight for universal childcare and pre-K and student loan debt cancellation and child tax credits, we're also simultaneously advocating for food equity. Because if you go to school to find yourself with hundreds of thousands of dollars in student loan debt, or if you find yourself paying more than half of your income just to keep a roof over your head or have some childcare for your children, then you're not going to be poised to be able to actually consume a health-promoting diet. You're also going to, on a very basic level, as Dr. Bleich just talked about, you're going to be more likely to experience nutrition insecurity, and that's going to make it far less likely for you to be able to eat and feed your family with nutritious food. And so the point that I want to leave all of you with is just that let's never forget that policy efforts to achieve equity in domains like housing and education and criminal justice are not just core, but they're actually essential to our mission and our vision of food equity.
Wow, thank you for that. And we have a couple more minutes. If anyone wants to make closing remarks, we could do like a last little lightning round, maybe starting with Dr. Bleich.
Closing remarks. So, well, first off, it's been wonderful to hear from you all, to hear your insights, to hear your thoughts. I think that we are at a moment right now where there's very strong interest in this area from the federal government. There is very strong interest from advocates, from the research community. This is a window of opportunity. So if you're interested, lean in. If you have resources to contribute, use them. If you have equities in your organization that you can help promote these issues, please push against those to make a change. But this is a time where a lot can happen, and I would urge all of you who have the ability to make changes to do so.
Thank you. Dr. Odoms-Young, any closing thoughts?
I would say ditto. And just to add to that, look at your organization. Who are your contractors? Who are your vendors? Really making sure that you have equitable policies and systems in place. So it really starts with you. It's very hard for us to advocate outside of our organizations when we really need to start to look internal. And so small changes, no change is too small as well when we think about moving towards equity. So I would say, just learn as much as you can. Look within your infrastructure, start inside, and then move out into the community. And then who have you not partnered with? A lot of times when I look around, I'm like, who's not at the table? And so it's important that you realize and start to think about who's missing from the conversation, because if you have other ideas at the table, it can really help move your goals forward when it comes to equity and how you think about this issue. And so thank you so much.
Thank you. And Dr. Fielding-Singh, closing remarks?
Yeah, Dr. Odoms-Young, that was your last point was exactly what I wanted to touch on in this last minute, which was that I think for all of us, whether we're in the private or the public sector, whether we're in a community-based organization or in academia, we need to focus on ensuring equitable representation and voice and shared power around these issues. And that means, of course, ensuring that people with lived experiences with things like food and nutrition and security have seats at the table, but also that seat at the table is not just symbolic, but that it involves authentic and serious listening and being open to hearing things that are challenging or maybe present a different viewpoint than the one that you've been trained on or thought about for a long time. Because I think that unless these voices and experiences of the people who actually bear the weight and the disproportionate burden of food inequities, unless those voices are prioritized and centered, I don't think we're actually going to be able to design effective and tailored policies and interventions that leverage the assets and resilience of communities, but also work to meet the barriers and needs that they face. So I think that's something that we can all strive for in our work, whether it's as policymakers or practitioners or researchers.
Well, thank you. Thank you for that. And thank you all so much for joining us today. I do agree. It feels like a golden moment where this topic is really at the forefront across sectors. And I appreciate all the perspectives everyone has shared from their own seat. So I wish we had more time. I'd love for this conversation to continue. And thank you again to Dr. Bleich, Dr. Odoms-Young, and Dr. Fielding-Singh for that discussion. So as I talked about at the top of the presentation, this is really just the beginning. So as I said, PHA is releasing its food equity paper alongside this year's summit. And you can find that on our website at ahealthieramerica.org. You could also join a pledge of people that are joining the movement committed to improving food equity in communities around the country. So as we've all heard, there's work to do at every level, and no step is too small. So if you're joining us today, you're part of that work. Just by listening and raising your awareness to that, you're part of that work. So thank you all for joining. And I hope that you will join with PHA as we partner to transform the food system at every level. So I'm going to turn it back over to Dr. Carrie Cartwright to introduce our next session. Dr. Cartwright?